In this video, our subject is grooming patients and residents. We will discuss getting ready, how to assist with dressing, how to assist with hair care, how to shave a man's face, how to assist with care of hands and feet, how to care for eyeglasses and hearing aids, and finishing up. The practices associated with good personal grooming are important to maintaining both physical and mental health. Grooming provides an opportunity to closely inspect various areas of the body for abnormalities. Grooming further promotes physical health by helping to eliminate microbes that can cause infection. Being well groomed also helps people meet their need for self-esteem by helping them feel attractive to others. Think about your own daily grooming routine for a moment. What do you do each morning for the appearance of your clothing, your face, your hair, your hands? Now think about why you groom yourself each day. Doesn't it make you feel better about yourself? Helping patients and residents to feel good about their appearance is a key benefit of providing grooming assistance. When you help a person to put her best face forward, you help the person to feel better both physically and emotionally. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtain. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. Your role in grooming patients and residents includes helping them change their clothing, a routine part of morning and evening care that is also necessary after bathing or whenever their clothing becomes wet or soiled. The type of clothing worn by people receiving health care varies according to the type of facility and the abilities of the person. Whenever possible, allow patients or residents to choose their own clothing. Encourage them to choose items that are appropriate for the day's activities and weather. Many of your patients or residents will be able to dress themselves with little or no assistance. Others, however, will need your help. Always allow the person to do as much as she can independently, assisting only as needed, because maintaining as much independence as possible is important for the person's self-esteem. Before assisting a person with dressing, remember to wash your hands, and throughout the procedure, observe standard precautions. Prior to changing clothing or pajamas, gather your supplies: a bath blanket, clean clothing, and, if you are likely to come into contact with broken skin, gloves. Begin the procedure by positioning the bed at a comfortable working height for good body mechanics. And make sure the wheels are locked. Lower the head of the bed so that the bed is as flat as can be tolerated. If side rails are in use, lower the one on the working side of the bed, but leave the side rail on the opposite side up. Cover the person with a bath blanket. If the person is unable to hold it in place, tuck it beneath her shoulders.
You want to hold on to this? Okay.
Fan fold the top linens to the foot of the bed. For garments that fasten in the front, undo the fasteners, all buttons, zippers, snaps, or ties. Before continuing, determine if the person has any limitations that might make dressing difficult, such as an extremity that is weak, paralyzed, in a cast, or splinted. Perhaps the person has had recent surgery or has an IV line. If the person has a limitation, the side most affected by that limitation should be considered the person's weak side as you proceed with the dressing, and that side will require special consideration. A rule of thumb to remember is, when assisting with undressing, work with the strong side first. When assisting with dressing, work with the weak side first. Here, the person's left side will be considered the weak side. Gently lift the person's head and shoulders. Working with the person's strong side first, slide the garment over that shoulder and down the arm. Gather the loosened garment behind the person. Remove the garment by sliding the other sleeve over the shoulder and down that arm. For garments that fasten in the back, undo all fasteners. Then, to remove the garment, first have the person roll to the side facing away from you, or, as shown here, lift the person's head and shoulders. Then gather the garment around the neck and lift the garment over the person's head.
Okay.
I'm going to unbutton your pants first.
To remove bottoms, undo any fasteners. Then, ask the person to lift her buttocks off the bed, which will allow you to slide the pants down to the ankles and over the feet.
You want to roll toward me?
All right.
If the person cannot raise her buttocks off the bed, help the person to roll first onto her strong side. This will allow you to pull the bottoms down on the weak side. Then roll the person onto her weak side and finish pulling the bottoms down. If the person is wearing underpants, remove them in the same fashion. Now we will help the person to dress, beginning with her underwear. For underpants, face the foot of the bed and gather the underpants together at one leg opening and waistband. Slip one foot through this waistband and leg opening, then the other foot through the other opening. Slide the underpants up the legs as far as they'll go. Then ask the person to lift her buttocks off the bed and slide the underpants up the rest of the way. If the person cannot raise her buttocks off the bed, help the person to roll first to her strong side, allowing you to pull the underpants up on the weak side. Then, roll the person onto the weak side and finish pulling up the underpants. To assist the woman with putting on her bra, slip the woman's arms through the straps one at a time, starting with her weakest arm. Position the cups over the woman's breasts and make sure the band is flat across her chest. Then, raise the woman's head and shoulders so you can fasten the bra.
Okay. Thanks.
For a t-shirt, the bottom layer of a woman's twin set, or a man's undershirt, the procedure is the same. Face the head of the bed and gather the top and bottom of the shirt together at the neck opening. Place it over the person's head. Starting with the person's weakest side, slip both arms through their respective openings one at a time. Raise the person's head and shoulders so you can pull the garment down.
Oh, good.
For shirts and sweaters that fasten in the front, raise the person's head and shoulders. Then, as you face the head of the bed, place your hand and arm through the wristband of the garment. Starting with the person's weakest side first, grasp her hand, slipping the garment off your hand and arm while guiding the person's arm into the sleeve. Pull the sleeve up to the person's shoulder and bring the garment around behind the person. Then, guide the person's strong arm into the other sleeve. Pull the sleeve on completely. Finish by fastening the garment. For blouses that fasten in the back, face the head of the bed and place your own hand and arm through the wristband of the garment. Starting with the person's weak side, grasp her hand and guide it into the sleeve. Pull the sleeve up to the person's shoulder. Then do the same for the other side. Raise the person's head and shoulders and bring the sides of the garment around to the back. Then fasten the garment. For pants, use the same steps as with underpants. Face the foot of the bed and gather the pants together at a leg opening and waistband. Then slip a foot through the waistband and leg opening. Then repeat for the other leg. Slide the pants up the legs as far as they'll go. Then ask the person to lift her buttocks off the bed. Slide the pants up the rest of the way.
You want to roll toward me?
If the person cannot raise her buttocks off the bed, help the person to roll first to her strong side, allowing you to pull the pants up on the weak side. Then roll the person onto her weak side and finish pulling the pants up.
Other way? Up onto the rail. Good. Okay.
To put on hosiery, first gather the sock or stocking, bringing the toe and top together. Place the sock or stocking over the person's foot, then pull it over the heel and up into position. Make sure that the sock or stocking is seated properly on the person's foot, without any wrinkles or bunching. Repeat for the other foot. If the person will be getting out of bed, help her to put on shoes or slippers. First, loosen any laces. Guide the person's foot in using a shoehorn if necessary. Make sure the person's heel is seated properly and that the sock or stocking isn't bunched at the toe. Then, tie any laces and repeat the procedure on the opposite foot.
You ready to go?
But yes, indeed.
First, remove the hospital gown that the person is wearing by having the person roll onto her side, facing away from you. Untie the gown at the neck and waist. Then, assist the person back to a supine position. If the person is both unable to roll or to sit up, reach beneath the person to untie the gown at the neck and waist. Next, loosen the gown. Then, unfold the clean gown over the person's chest. Here, the arm with the IV line will be considered the weak side, and that side will require special consideration.
Go ahead and start with this arm. Put your arm on.
Working on the person's strong side first, remove one sleeve at a time. To remove the sleeve from the arm with the IV line, first remove the arm from the sleeve. Then, slide the bag and tubing through. Then rehang the bag. Place the soiled gown into the soiled linen hamper. Then put the IV bag through the sleeves of the clean gown, followed by the tubing. After placing the IV bag on the hook, guide the person's weak side into the sleeves of the clean gown. Then, guide the other arm, the strong side, into the other sleeve. Have the person turn onto her side, facing away from you, so that you can tie the gown at the neck and waist. Adjust the gown so that it fits comfortably. If the person is unable to roll, reach under the person and tie the gown. To complete this procedure, complete your finishing up steps as described in the final section of this video. Just like you and me, patients and residents are conscious of having good hair days and bad hair days. One of our tasks is to maximize the good hair days, because having clean, attractive hair makes everyone feel better about themselves, and, as always, cleanliness contributes to good health. Prior to assisting with combing, gather your supplies, then make sure the bed is positioned at a comfortable working height and that the wheels are locked. Your supplies will include paper towels, a wide-tooth comb or pick, a brush, mirror, towels, and optionally hair accessories and detangler or leave-in conditioner. Cover the overbed table with paper towels, then place the hair care supplies and clean linens on the table. Raise the head of the bed as tolerated.
We're going to fix your hair.
Oh, good.
If the side rails are in use, lower the side rail on the working side of the bed while leaving the side rail on the opposite side of the bed up. Gently lift the person's head and shoulders and cover the pillow with a towel. Then, drape another towel across the person's back and shoulders. If the person's hair is tangled, as in this example, work on the tangles first. Put a small amount of detangler or leave-in conditioner on the tangled hair. Next, begin at the ends of the hair and work toward the scalp. Use one hand to gently grasp a section of the hair just above the tangle and closest to the scalp. This will help prevent pain caused by pulling the hair. Then use the wide-tooth comb to gently work through the tangle. Once the tangles are removed, use the brush and gently brush the hair, working with one 2-inch section at a time and moving from the roots of the hair toward the ends. Next, secure the hair using barrettes, clips, or pins, or braid the hair as the person requests. If tangling or matting is a problem, braiding the hair will help to prevent tangling while giving a neater appearance. Whenever possible, allow the person to decide how she wants her hair styled. If the person is on bed rest, be sure to avoid styles that cause pressure on the back of the head or scalp, such as a bun or ponytail.
Yeah.
When you are finished, offer the person the mirror to check her appearance.
Oh, yeah.
To complete this procedure, gather any soiled garments and linens and place them in the soiled linen hamper or bag. Clean and store equipment, then complete your finishing up steps as described in the final section of this video. While assisting with hair care, be sure to notify the nurse if you observe any of the following: flaking, crusting, or scaling of the scalp, redness, itching, or tenderness of the scalp, unusual hair loss, especially if it is occurring in patches, a foul smell, severely matted or tangled hair, or nits, which are lice eggs. Nits often appear as flakes that cannot be brushed off. Many patients or residents will be able to shampoo their own hair. Others will need varying degrees of assistance, especially those who are confined to bed. Shampooing a person's hair in bed starts with your getting ready steps, beginning with washing your hands and observing standard precautions. Then, gather your supplies: paper towels, bed protector, wash basin, water pitcher, bath thermometer, shampoo trough, comb, brush, shampoo, washcloth, and towels. You may also need a blow dryer, hair conditioner, and, if contact with broken skin is likely, gloves. Begin the procedure by covering the overbed table with paper towels. Then put your supplies on the paper towels. Position the bed at a comfortable working height to promote good body mechanics. Make sure the wheels are locked. Fill the pitcher with warm water, about 100 to 115 degrees Fahrenheit. Next, if using gloves, put them on now. Note that wearing gloves may cause accidental pulling of a person's hair during combing or shampooing, so use them carefully and only if you feel they're necessary. Next, raise the head of the bed as tolerated.
Go ahead and comb your hair, okay?
Comb the person's hair to remove tangles. Then, lower the head of the bed so that the bed is flat, as tolerated. If side rails are in use, lower the side rail on the working side of the bed. Gently lift the person's head and shoulders and reposition the pillow under the shoulders.
Now put this under your pillow.
Cover the head of the bed and the pillow with the bed protector. And place the shampoo trough on the bed protector. Help the person to rest her head on the shampoo trough. Put a towel over the person's chest and shoulders. Put the wash basin on the floor, positioned so that it catches water from the trough. Ask the person to hold a washcloth over her eyes. Roll up your sleeves. Then pour water over the person's hair until the hair is completely wet, using your other hand to direct the flow away from her eyes and ears. Apply shampoo to the wet hair. Lather and massage the scalp. Then rinse. If requested, apply conditioner and rinse again. Lift the person's head and shoulders and remove the trough. Wrap the person's hair in a towel, then remove the bed protector. Raise the head of the bed, then dry the person's face, neck, and ears, and finish towel drying the hair. If any linens have become wet or soiled, replace them now. Comb the person's hair to remove snarls and tangles. Then dry and style it as the person desires. If you are using a blow dryer, be sure to use the cool setting and take great care not to burn the person's scalp or face. To complete this procedure, gather any soiled garments and linens and place them in the soiled linen hamper or bag. Clean and store equipment, dispose of any disposable items, then complete your finishing up steps as described in the final section of this video. Most of the grooming procedures we've demonstrated list gloves as an optional consideration for use when you risk coming into contact with broken skin. However, in our next procedure, shaving a person's face, gloves are mandatory because any cut or nick will put you at risk for exposure to blood-borne pathogens. Always check with the nurse or consult the person's care plan to make sure it is okay to use a safety razor. For a person who is on blood thinners, an electric razor might be recommended instead. In any event, if the person is able, he should do his own shaving. Shaving someone's face with a disposable razor starts with your getting ready steps, beginning with washing your hands and observing standard precautions. Then, gather your supplies: gloves, paper towels, disposable razor, shaving cream, wash basin, bath thermometer, mirror, washcloth, and towels. You may also need aftershave lotion. Begin the procedure by covering the overbed table with paper towels. Then put your supplies on the paper towels. Position the bed at a comfortable working height to promote good body mechanics. Make sure the wheels are locked. Put on the gloves. Fill the wash basin with warm water, about 100 to 115 degrees Fahrenheit. If side rails are in use, lower the side rail on the working side of the bed. Next, help the person to a sitting position, either in a chair, on the edge of the bed, or with the head of the bed raised. Place a towel over the person's shoulders and chest. To soften the beard, wet the washcloth in the wash basin and hold it against the person's face for 2 to 3 minutes. Then remove the cloth and apply shaving cream to the person's beard stubble. To shave, start with the cheeks. Pull the skin taut and shave in a downward motion toward the chin. Use short, even strokes and rinse the razor frequently. Continue until all the lather on the cheek is gone. Repeat for the other cheek. Then shave the chin. Ask the person to tighten the skin by drawing the lower lip inward and over the teeth. Use short strokes and rinse the razor frequently. Continue until all the lather on the chin is gone. Next, shave the neck. Ask the person to tip his head back. Pull the skin taut and shave up toward the chin. Use short, even strokes and rinse the razor frequently. Continue until the lather on the neck is gone. Finally, shave between the nose and upper lip. Ask the person to tighten his upper lip by drawing it down over the teeth. Shave here with downward strokes, washing the razor frequently. Continue until the lather is gone. If you observe the person's face bleeding from any shaving nicks, apply direct pressure with a tissue until the bleeding stops, and report the incident to the nurse. To complete the procedure, raise the side rail if necessary and change the water in the basin. Form a mitt around your hand with the washcloth and wet the mitt with the warm, clean water. Wash the person's face and neck, then rinse thoroughly. Use the towel to pat dry the face, neck, and ears. If requested, apply a small amount of aftershave lotion. To complete this procedure, gather any soiled garments and linens and place them in the soiled linen hamper or bag. Dispose of any disposable items. The disposable razor is considered a sharp object and therefore should be placed in the sharps container. Clean and store equipment, remove your gloves, wash your hands, then complete your finishing up steps as described in the final section of this video. Soft, smooth skin and trimmed filed nails feel wonderful and are essential for preventing injury and discomfort. In addition, caring for a person's hands and feet gives you the opportunity to spend quality time with the person and to observe for signs of health. While assisting with care of the hands and feet, be sure to tell the nurse if you observe any of the following: nails that are unusually thick, nails that are unusually yellow or white, nails that are broken or have been cut too short, nails that are ingrown, nail beds that are pale, blue, or bruised, cuticles that are torn, red, or swollen, skin that is blistered, red, or tender, or any unusual rashes or odors. Care of the hands and feet starts with your getting ready steps, beginning with washing your hands and observing standard precautions. Then, gather your supplies: paper towels, orange stick, nail clippers, nail file, bath thermometer, emesis basin, soap, lotion, washcloth, towel, and, if contact with broken skin is likely, gloves. You might also need nail polish remover, nail polish, and cotton balls. For the feet, you should add a wash basin, a bed protector, and a nail brush. Cover the overbed table with paper towels and place your supplies. Make sure the wheels are locked. As this resident will be remaining in bed for this procedure, we'll raise the bed to a comfortable working height. Put some liquid soap in the emesis basin and fill it with warm water, 100 to 115 degrees Fahrenheit. Place the emesis basin on the overbed table. Put on the gloves if contact with broken skin is likely. If side rails are in use, lower the side rail on the working side of the bed.
Get your head up, son.
Next, raise the head of the bed to the Fowler's position.
Nice and pretty. You have some visitors today.
If the person wants nail polish removed, now is the time to do it. Put a small amount of nail polish remover on a cotton ball and gently rub each nail. Next, help the person soak the tips of her fingers in the basin. If you are assisting with foot care, place a bed protector on the bottom sheet. Place the wash basin on the bed protector and place the person's feet in the basin. After about 5 minutes, lift one hand or one foot out of the basin and wash it with a soapy washcloth. For foot care, you can also use a nail brush to gently scrub any rough areas. Use the orange stick to clean underneath the person's nails. Rinse, then dry the person's hand or foot with a towel. Repeat with the person's other hand or foot. Next, if your facility policy allows, push back the person's cuticles with the orange stick. If the nails need to be trimmed, use nail clippers. Or, if clipping nails is outside your scope of practice, tell the nurse about your need for assistance. Next, use the nail file to smooth the rough edges of the nails. Apply lotion to the person's hands or feet. If the person requests, you may also apply a fresh coat of nail polish at this time. To complete this procedure, gather any soiled garments and linens and place them in the soiled linen hamper or bag. Dispose of any disposable items. Clean and store equipment. Remove your gloves. Wash your hands. Then complete your finishing up steps as described in the final section of this video. Many of the patients and residents in your care will wear eyeglasses to correct their vision. Remember that eyeglasses are very expensive and it may be difficult for the person or family to replace them if they are lost or damaged. Be very careful not to drop the glasses or scratch the lenses as you clean or handle them. To clean eyeglasses, you'll use warm water or a solution made especially for cleaning glasses and a soft cloth, or tissues that are lotion-free. The warm water and gentle rubbing will remove most smudges and dirt. For many patients or residents, their everyday grooming routine will include caring for and applying a hearing aid. As with eyeglasses, hearing aids help a person to interact more easily with others. To assist a person with applying and removing an in-the-ear hearing aid, start by washing your hands. To remove a hearing aid, first turn the device off. Then, gently pull up on the person's ear so that you can lift the hearing aid up and out. Prior to storage, you may need to remove the batteries from the device, depending on your facility's policy. Then, after making sure that the case is labeled with the person's name, store the hearing aid in its case. Then, wash your hands. When inserting a hearing aid, if the batteries have been removed, first, carefully reinsert them in the correct orientation. Then, check to make sure the hearing aid's volume is down and the device is turned off. Help the person to a comfortable position with her head turned so that the ear needing the hearing aid is closest to you. Check the ear for excessive cerumen or earwax. If you see excessive wax buildup in the ear, gently wipe the ear canal with a warm, moist washcloth. Be sure to stop the procedure and tell the nurse if you cannot remove the excess wax this way. Next, insert the tapered end of the device into the external auditory canal. While using one hand to gently pull down on the person's earlobe, use the other hand to push the device up and in, rotating it so that it fits the curve of the ear. The hearing aid will fit snug and flush with the ear. Once positioned, turn on the power switch. Talk to the person as you increase the volume. Continue to increase the volume until the person can hear you.
How's that?
After you have finished, wash your hands. When you have finished with a procedure, always follow a routine of finishing up to ensure your patient's or resident's safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you used gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.